This morning on Today's Health, what's your body telling you? Your body can speak volumes about your health. If you listen closely and recognize some important warning signs, you may be able to spot serious conditions early. Dr. Keri Peterson is an internist and contributor to Women's Health magazine. Dr. Peterson, good morning.
Good morning.
This is interesting because sometimes kind of symptoms that don't seem that serious might point to an underlying medical condition. Let's start with the mouth. If you notice the corners of your mouth are cracked, what does that mean?
That can mean that you have a vitamin deficiency with the B vitamins, B2 or B6. Or it can mean that the saliva is pooling in the corners of the mouth if your lips tend to fold in. So if you find that you have cracked mouths, this actually also can be seen in eating disorders. You should try to supplement your diet with the B2 and B6 vitamins, which are the green leafy vegetables and almonds. Or if you notice that you're someone who gets saliva in the corners, use some petroleum jelly just to protect the skin.
Okay, might relieve it if it hurts a little bit.
Correct.
What about a white coating on your tongue? What does that mean?
That can be significant for something called thrush, and that's a yeast infection of the mouth. Now, we normally have yeast in our mouths in balance with bacteria, but there are certain conditions that can override the bacteria and then the yeast thrive and overgrow, and it creates this white carpet that can burn the tongue. And these things include antibiotics, diabetes, and if you use an inhaled steroid for treatment of asthma, that can trigger it as well.
So what do you do to get rid of it?
It does need to be treated with a prescription antifungal to get rid of it.
Okay, let's move on to the skin. A lot of women have this brown splotches on the face.
Yes.
What does that mean?
That is called melasma, and that's a pigmentation that you see on the forehead, the cheeks, and on the upper lip, and it's often triggered by birth control pills as well as pregnancy, and it can be very, very upsetting for patients because it's difficult to treat.
That graphic showed us, you're talking about a large spot, not these little spots.
Right.
I like to call beauty spots, but are really age spots, not those.
No, they're large patches,
yes.
And it can be quite disfiguring, and a lot of my patients that have it get very upset about it. It can be tough to treat. If you stop the birth control or if you deliver your baby, it tends to get a little better, but that also often needs a prescription cream or a laser treatment.
What about thick, dark hair around the belly button? Some women have complained of this.
Now, most often this is genetic, but there are times where it can be due to a condition called polycystic ovarian syndrome. And what this is an overproduction of the male hormones that women do make. And it affects 1 in 10 women and can contribute to infertility. So it's something to definitely be aware of and bring to the attention of your doctor.
Okay, our next sign, dark circles under the eyes. A lot of women have this, but you're saying it's more than a cosmetic concern.
That's right. If it's not going away, it may not necessarily be because you didn't have a lot of sleep last night. If it's persistent, it can be from allergies. When you have allergies, the vessels around the eyes tend to dilate, causes these blue circles, and if you treat the allergies with antihistamines or if you avoid the allergen triggers, it will go away.
A yellowish bump on the white of your eyes, what is that?
This is called a pingecula, and this is a little white nodule that you see on the white of the eyes in this picture. And this is triggered by overexposure to sun, wind, or dust. So if you see this developing, you need to really be a little more diligent about taking care of your eyes, either by using lubricating drops and certainly by wearing sunglasses that have UVA, UVB protection.
And will it eventually go away?
Doesn't go away, but it can even get bigger.
So you're trying to make it not get bigger.
Right.
Okay. A scalp, your scalp shedding. Is that dandruff? What is that?
Flaking, yes.
Yeah.
This is dandruff, and there are several underlying causes. One is the well-known fungus that can be treated with dandruff shampoos, but it also can be triggered by changes in weather. We're now entering the fall season, and it may get worse in these scenarios. And it also can be triggered by stress, which a lot of people aren't aware of. Cortisol, which is produced when you're stressed, can dry out the scalp and cause it to flake and scale.
Okay, hair thinning, what could that be a sign of?
That can be a sign of thyroid disease or of iron deficiency. So if you do notice your hair starting to fall out, get those checked by your doctor.
Okay, let's move to the nails.
Yes.
If you see a dark kind of line on your nail bed, should you be concerned?
You should be. This may be a sign of melanoma, which is a type of skin cancer. So moles are not the only red flags for skin cancer. You can see in this image a dark stripe down the nail.
Is that kind of like a mole under the nail?
That's right, exactly. It's damage under the nail. It's a mole under the nail, and it should be seen. We at Women's Health recommend if you see this, go to your dermatologist.
All right, and what if your nails are kind of brittle and cracked and splintered? What's that a sign of?
Could be a vitamin deficiency like calcium, vitamin D, or zinc, or it could be that you have your hands in water too often, you're washing them too much, or getting too many manicures.
Oh, I was going to say stop doing the dishes, and I was going to recommend a manicure, but too many manicures not a good thing.
Right.
Good to know. Dr. Keri Peterson, thank you so much.
Thanks.